Hello, everybody on the camera. Welcome to the Youth Sport Injury Workshop. Thank you for those of you who rescheduled with us. We are sorry, emergencies happen and things come up. So thank you so much for being here, and thank you for the people that are watching online. We're going to tell you a little bit about ourselves. We're going to tell you a little bit about what we're going to talk about tonight, and then we want to hear from you guys too, if you're comfortable telling us what brought you here. And then we'll get into the nitty-gritty. You have folders in front of you. Feel free to look through them. Feel free to take notes. There will be time at the end for questions. And then we'll also kind of talk to you about next steps if you're in a point right now where you're interested in learning more information. So take it away.
All right. So I'm Brittany. I've been a PTA since 2019. Most of my experience is in outpatient. I work in a nursing home a little bit too. Not pertinent to here. I coached youth soccer from ages under 8 to under 14. I currently still play at the ripe age of 36 years old. I have taken multiple continuing education courses over the year regarding ACLs, rotator cuff, musculoskeletal injury management, post-operative injury management, and I'm just constantly looking to learn and educate.
I'm Corey. I've been a PTA since 2021. I've worked my entire career in orthopedic physical therapy, specializing in athletic performance, post-injury, post-surgical rehab. Like Brittany, I've also worked in other settings as well, just to broaden my knowledge, but the primary focus has always been orthopedic outpatient, like a place like this, but also working in post-surgical. I have additional training and certifications in functional movement screen, pain neuroscience, ACL injury prevention, as well as ACL post-op rehab, treatment of the athletic shoulder, treatment of the female athlete, and then treating athletes through the ages from pediatrics all the way to geriatrics. So we as an organization, all of Houghton Physical Therapy, we are proud local community advocates here in Attleboro and the neighboring towns. Bunch of places listed up there that we do. We have all the social medias where we constantly are posting educational stuff. If you haven't seen it, give us a follow. You'll probably see me and Brittany on a lot of it because we enjoy educating and being on camera. But specifically, Brittany and I, with the help of Tracy, recently developed the strength and conditioning as well as the active warm-up programs for the Attleboro Youth Soccer League, which was a newer partnership that we're really excited about. We met with all of the coaches from their spring season and the director of skills development and kind of taught the coaches how to teach the kids. And then we also had resources go out to the parents through them, including what you see on the bottom there is our YouTube videos for like simple injury rehab. If your kid is complaining of one of these things, follow this. That may not be the answer. You may have to call us, but so we have a ton of resources, totally free online that we love to do with the community. So yeah, another thing here, bringing free education to people.
Okay, so we're gonna get to in a minute why everyone is here, but we're going to assume it's some reasons listed here. So you show up to every practice, you drive to every game, invest in gear, coaching, camps, and your child keeps getting hurt, burning out, or pulling away from a sport they used to love. You're not alone. Youth sports injuries are at an all-time high right now, and most families don't get clear answers on what to do differently or how to prevent these injuries. So again, these are just some potentially familiar patterns, including the repeat injury. Your child sprains their ankle, they rehab it, they go back, they sprain the same ankle, and it keeps repeating over and over. The growing pains, so your child, again, is complaining of knee pain, and the pediatrician or the coach says it's just growing pains, like they'll grow out of it, they'll be fine. The burnout spiral, so basically your child is either uninterested, they're complaining about having to go to sports, complaining about being tired, not looking forward to going to games and practices. And then the movement gap, so meaning your child is feeling inadequate compared to their peers because they can't keep up physically, not even talent-wise, just either speed, strength, agility with their peers, again, leading them to not want to participate in sports.
So tell us why you guys are here. If you're not comfortable, that's totally fine, but we would love to hear from you, your name, what brought you here. Are you a parent? Are you a coach? Are you a kid? I'm assuming we have some kids in the room, which is totally fine because we're going to talk a lot like at parents, but you guys seem like you're old enough to start kind of starting to make your own decisions. You're still live under your parents' roof, so you have to just listen to them. But you know, investing in your own health, investing in your own decision making, maybe going to college to play sports fairly soon based on just what I'm seeing from looking at you. So I'm glad that you guys are here, and anyone that's comfortable speaking up, we would love to hear why you're here before we just talk at you. Yeah.
My name's Holly, and I am a parent and a coach. So I am a volleyball coach for the small school in Attleboro, Baptist Christian Academy, and I coach the children from middle school all the way up to high school. So it ranges from 5th grade all the way up to 12th grade.
Oh, wow.
Awesome.
And then I am a parent who has a daughter who's going into 10th grade and a son that's going into senior year, but neither one of them are athletic. Don't like sports or anything, so I think I missed the boat on that one, considering I was an athlete my high school and college years. But I think for me, it's mostly trying to help the students try to understand and prevent some of the pain that they have. So
Absolutely.
I'd love to put together like a regimen for them. It sounds like you did that with the soccer team. So I'd love to do something like that for the volleyball girls and send it out because I told them that, you know, it's not going to be an easy season.
Good.
Awesome.
Yeah, and let's
Love that.
make it an injury-free or mild injury season. Yeah, I think you'll learn a lot tonight, but we're probably going to have to chat with her after on helping you get with that. Yeah.
Absolutely.
Anyone else?
So right here.
I see we have a basketball and maybe track.
Yep.
Okay.
They've done sports since they were 4, so we've been down this road for a long time. One of my questions was like, how do you know when it's time for someone to see your kid? My husband and I, my husband's a little bit older, but we're both in that, like, our parents didn't take us to the doctors unless we were like, our arms were
Dying.
Yes,
Yeah.
yes.
And so, we're kind of like, work through it, stretch, do this, do that. And I feel like it's been a lot of many years. And when you said like the pediatrician's going to say it's growing pains and so on, Lisa's always had a lot of knee pain, like a lot of knee
She's
pain.
tall. Yep.
Yes. So she doesn't always follow what people might suggest, like wearing the Taliban's, that kind of stuff.
We were teenagers too, Reese. Don't worry.
And Quinn, they're twins. They've always kind of done the same thing up until they're going in their sophomore year. And Quinn realized that she was a runner, so she runs year round now. So in like early March, she got hurt, and I did not want her to run year round. So her and my husband did. So that was an argument I lost, and then she got hurt and didn't tell us, and then got a little more hurt. So her season was kind of squashed pretty early for the spring season. Very upset, like,
Of course.
definitely not me. I never played sports. I played sports because my parents made me. It was like rec. But I love that they love sports and I love watching them. But I never know when, like, my husband and I go back and forth. Sometimes I'm like probably being overly cautious, and he's like, well, we're not bringing them to the doctor for every certain thing that they have. But it is funny because Quinn has been to Ortho Rhode Island 4 or 5 times, and Reese has never been, and which makes me very nervous because her knees are really bad.
Yeah.
So I was like, all right, we're going to this, we're sitting down, and we're gonna have, my husband actually came, he had frozen shoulder, and he came to Todd, and Adam, I think is that?
Mhm.
The guys, for a whole year, because they said they could get him back without surgery, and he like raised him up. So I was like,
Awesome.
all right, we're going to this, and we're sitting
Yeah.
down. He was gonna be here, he would have been here last week, but he's away for work. So I'm like, we're going, and we're gonna figure this thing out.
Yep. I think you guys are going to learn a lot tonight, and I think it's probably going to be, let's have a more of a one-on-one conversation
Yes.
with the girls together or separately or whatever. And yeah, you'll hear more about how to set that up later. Yeah? Anybody else? Don't feel obligated, but yeah.
I'm a coach and a parent. I have a soon-to-be junior high school football player, who's 6'3" and 292 pounds.
Nice. Born to play
His
football.
ankles are bothering him. And then I have an 11-year-old daughter who's a cheerleader, and I coach cheer as well.
Awesome.
Kind of looking to see, like, no matter how many times they tell me, you need to rest, you need to ice, you need to wear, like, supports on it, like, so it's all my,
Yeah.
I know.
Big kid. Yeah. Okay.
My name is Shanna. I'm his parent. My son's going to be entering fourth grade. He plays soccer, absolutely loves it. We just ended up for club, and he has this reoccurring ankle issue since we had the Mansfield tournament. And I've been doing the steps, like the icing, the elevating, trying to get more insight on stretching at home or doing it on the field, because sometimes at practice we don't do that. I know they do warm-ups, but not like dynamic stretches, and I'm not sure if I should really just take ownership of that at home and set them up on a routine. My daughter is going to go into third grade and she's in cheer, she loves that, but to also get some insight so she doesn't have injury and stretching and using dynamic stretches on certain movements that should be doing in cheer. This is very insightful.
Yes, absolutely. Anyone else?
My name's Brad. I've been a high school coach of Alpha Frisbee for 12 years.
Oh, nice.
And I think I'm working with school grade kids, so.
Yeah,
All right.
absolutely. Perfect. Thank you guys so much for sharing. For those of you watching virtually, feel free to reach out to us and tell us why you were here and what you got from it. We would love to hear that too. Okay, so we're getting into it. Take all the notes you need. There'll be time for questions at the end, but if we start going really fast, just raise your hand and say, please, God, slow down. Yeah, absolutely. Okay, so why do these athletes keep getting hurt? So there's many common reasons we find that athletes get injured. Some are so common we literally have the answer on how to prevent it. It's not a secret, but we may feel like we're sharing a secret with you. So this is a large portion of what you're going to learn about today. This is not in depth. We're going to go in depth, I promise. But times of growth spurts is huge. I think that might be what we're thinking about with Miss Reese here. We can predict growth spurts. You as parents are literally seeing it happen, and pediatricians can actually predict it happening. Volleyball players, super tall, basketball players, super tall, all those kids, right? Big growth spurts. It happens in real time, and it's time where your athlete is going to need specific focus on strength and conditioning as well as extra rest time. We'll talk more about that later. Overtraining is so common nowadays. More kids are specializing in sports and far too early. The research is against it, but pressure on it continues. It's like every kid now plays one sport or two sports all year round. That was not even a thing when I was a kid, right? Like 15 years ago.
I feel like when they were
Right.
literally started playing middle school.
Recently.
They
Yep.
still love soccer and they didn't do club, and that was that.
Yep.
Don't do club and
Exactly. Yep. It's a huge thing now, and it's posing a large injury risk. And the majority of youth athletes that we treat in PT, especially here and especially myself, I can say they're all year-round athletes and they're all injured and in PT. Poor movement foundations and lack of strength development, those for me coincide, so I'm just gonna kind of lump them together for this portion. That's really the foundation of what we're gonna talk about today. That's the meat and potatoes of it. Younger athletes need to learn foundational movement. So those of you that work with or have the younger ones, the elementary school, that's when they start learning how to move their bodies and the right ways to move their bodies. So we call it strength training for elementary school kids, but we'll talk about that a little bit more. They're not going in that squat rack. Here it says, I really like exactly what this says. Young athletes often have underdeveloped strength relative to the forces they're absorbing. That's huge. That's like the key. It's like they're not weak, although some of them honestly are weak and they just need to get stronger. It's that the strength and conditioning that they're going through is not meeting the demands of the sport, right? Like soccer's a pretty intense sport. Little kids are playing soccer. That's great. I love it. But do you know what like professional soccer players do to strength and condition? You got to get there, right? So they got to meet the demands. Yeah, we'll talk more about these in depth as we go.
So some common sports injuries. We're not going to go super in depth, but back pain, very common in gymnastics, cheerleading. Groin strains, very common in soccer, especially without a proper warm-up. If you just get on the field and start shooting, you're probably gonna strain something. Quad and hamstring strains, patella tendonitis, ACL sprains and tears, much more common in females. Shin splints, common in runners. Ankle instability or chronic ankle sprains. Patellofemoral pain syndrome, which is in the knee. Jumper's knee, UCL, which is in the elbow. Sprains, common in baseball. Labral tears and subluxations, that could be in the shoulder or the hip. And then growth plate injuries. Osgood-Schlatter, has anybody heard that word before?
Yeah, it's a common knee one.
A lot of people hear it, but they don't know exactly what it is. Seavers, OCD, and Little Leaguers, elbow/shoulder.
Again, we're not gonna like go in depth to bore you on those because some people won't care about them. Like, oh my God, my kid was diagnosed with this. Please tell me more. We'll talk about how to do that later. So common injury risk factors. So the biggest signs that are going to show you that future injury is coming are here. The first one is actually previous injury, specifically to that area, and if it wasn't rehabbed properly. So if your kid sprains their ankle, they probably sprain their ankle all the time. It's just how it works, right? If you didn't properly rehab the sprained ankle, it's gonna keep happening. I'm just using ankle as an example, but that's the highest indicator for a hamstring strain is previous hamstring strains. A huge one is muscle imbalances, whether that's left versus right or whether that's joints that connect, right? So if your hip isn't strong enough to stabilize your knee, you're gonna hurt your knee, vice versa. If your left side is a lot stronger, which happens a lot in soccer because there's one plant leg, one kick leg, that it's a huge predictor if one leg is stronger than the other that you're gonna injure one of your legs. And there's tools to easily find these muscle imbalances and then work on it before an injury maybe even happens. Poor conditioning. So a fatigued body gets injured. Whether it's during a game, whether it's between games, rest is crucial, and so is the level of conditioning, like we talked about, to meet the demands of the sport. Improper footwear is a huge one. That's kind of a specialty, a niche thing, but the right footwear for your sport, your body, and what your foot can do is very important. So this could just be, wearing the right size or the right fit cleats or sneakers during sport, but also the kids nowadays, oh no, that just walk around in like Uggs, Crocs, sandals. You wear them to just go out, that's fine. If you wear them to PT, if you wear them to practice, that's kind of a problem, right? Like your foot needs support. You shouldn't be walking around all day in unsupportive shoes. It's the thing now, sorry girls. So footwear is important, not just on the field or on the court or whatever sport we're playing, but just in general, their foot's gonna adapt to what they're walking in most of the time. Growth spurts, like we talked about, huge, huge, huge. So a growth spurt, again, you can see it happening as parents, the pediatrician can usually see when it's about to happen or in the process of happening, but it's characterized by 2.8 or more inches of growth in a year. So these kids are at a huge risk of injury because the bones are growing fast and all the tissues around it, AKA muscles, ligaments, tendons, aren't growing as fast. They're trying to catch up. So during this time, the muscles are gonna take longer to catch up, putting them at a huge risk of injury if they're overtraining or mistraining. So this is where specialists like pediatricians or sports professionals can see that happening and know how to properly load and stretch the tendons and the muscles. They're at a huge risk for straining, spraining, or even tearing a muscle or a tendon in this portion. So huge eye coaches and parents on when a kid is going through a growth spurt. I see it sometimes if I'm treating a kid for like 4 or 5 months in PT. I'm like, I think you've grown like 6 inches since I met you. There's a special way to train these kids. And you don't want that to be detrimental. Another thing with growth spurts that we briefly mentioned, and again, we won't go into depth, but if it's something that you've heard with either your personal kids or the kids you coach, is those growth plate injuries. Those happen a lot of times in the younger kids or during the time of growing. Osgood-Schlatters, Seavers, which is in the heel, ankle, Little Leaguer's elbow, those big ones where the growth plates can actually like not close like they're supposed to because of the strain on it. And that can really set you up for like a future surgery. I've seen like 30, 40-year-olds getting surgery to correct Osgood-Schlatters that they didn't when they were a teenager. So not to scare you, but definitely look out for those things. We're going to talk more on nutrition later, but nutritional deficiencies, especially in girls, can really impact your athletic performance as well as just your health in general. It puts you at a greater likelihood of fatigue, muscle loss, and stress fractures if you're not having adequate nutrition. And then excessive sport-specific training, we'll talk about that a lot, so I won't get too much into it. Doing too much too soon, I don't know how else to say, you're gonna get hurt.
So, there's a better way forward. We obviously can't prevent every injury from happening, but it is a real problem, and we do have some solutions. When you understand what's actually driving the injury, it's gonna be much more powerful, and you're gonna be able to obviously, hopefully avoid injuries and thrive in your sport. And again, even we're gonna get to kids who maybe aren't interested in sports, but how important it is to implement some form of movement throughout their entire life.
Okay, so a smarter approach. Building the foundation of an athlete is not about building their talent. That's what everybody thinks it is, it's not. It's about developing their movement quality, their strength, their ability to know when and how to recover, and as well as their confidence, right? That's huge too. We'll touch a little bit on mental health. Each athlete deserves a personalized plan. There's no one-size-fits-all program for all kids. Like you're saying, these girls are twins, right? And up until very recently, they did everything the same. Now they're not. They're different heights. They look the same. They like different sports. So that's a perfect example. Thank God for the twins being here. I'll give you $5 later. All kids develop at different rates and levels, no matter the age, no matter the sport they play. They're all different, and they deserve a personalized plan. Okay, so now we're gonna go in depth. We're gonna break some of those topics that are hot button topics down. We're gonna spend time talking about the different things that can make or break the child's performance.
Okay, so I don't know if we've mentioned this yet.
These guys.
But early specialization is not where it's at. Playing multiple sports is extremely beneficial. It's a very common misunderstanding that consistent training in one sport will make the child excel in that sport, but that's actually not true. Studies show that athletes who participated in 3 sports or more between the ages of 11 and 15 were more likely to play national. Another one showed that 88% of D1 athletes played more than one sport through high school and up to college. So you definitely want to do what's called sampling. So basically participating in multiple sports and different positions in each sport. Like not just, I'm a hockey goalie, I play goal, that's it. Like you want to kind of like test your body and put it through different sports and different patterns. We reference some professional athletes here. I'm sure most of you are familiar between basketball, baseball, playing multiple sports, and they're all doing pretty well for themselves at this point. So
Hopefully, hopefully the last one keeps doing well for himself. Okay, so rest and recovery. So I won't read these all to you, but make note of your child's age or the age group that you coach. Your child getting the designated hours of sleep for their age bracket is important for many reasons, sports aside. These are the recommendations from the American Association of Pediatric Medicine. 8 to 10 hours is kind of a lot. I don't know if many 18-year-olds are getting that, but that's what's recommended. However, studies do show that less than 7 hours of sleep per night has been linked to increased injury risk and decreased performance levels. Rest time is recovery time. It's about more than just being tired, right? We all know sleep is when your body regenerates. I don't need to get into all that. I'm sure we all know that. Also keep in mind that children and teens should not formally train in sport. That includes games, practice, even if they're practicing separate from the team in the yard or on the field on their own, for more hours per week than their numerical age. I don't know if that makes sense because that seems like confusing to me until I break it down. So if you have an 11-year-old, they should be participating in 10 or less hours of formal sport per week. Play and activity time is different, recess, whatever. So if you count up how many hours they're spending in games, in practices, in training sessions, in the gym, that number of hours per week should equal less than their age number. That doesn't happen most of the time. So that's a sign of overtraining, right? And if you feel like, wow, my kid is doing like 10 hours more than they're recommended, that can't be right. This is what the coach is saying. We would love to talk about that and break that down with you guys. Also rest days. So 1 to 2 days off per week from organized sport is recommended, especially in times of competition, People always think when like playoffs are coming up or like a weekend tournament is coming up that they need to practice and play more. It's actually the opposite. They should be resting more to prepare for that large amount of time playing coming up. And then taking a season off. It's not recommended to play more than 8 months of the year in a single sport. Like we talked about, the year-round sports is all the rage nowadays. It's really like the opposite of what research is showing.
So signs and symptoms of overtraining. There are some stages of overuse injuries that ideally we stop at stage 1, being pain in the affected area after physical activity, and then going into pain during the activity that does not restrict performance levels, then progressing to pain during the activity that does restrict performance levels, and then moving on to chronic continuous pain even at rest. So again, we're trying to cut this off ideally at 1, maybe 2, but let's not get to 4. Some other signs of overtraining: lingering muscle soreness, decline in performance level, mood changes or irritability not otherwise explained, trouble sleeping, frequent illnesses, loss of appetite, decreased motivations for sports, and difficulty concentrating.
Okay, so strength and conditioning, that's our bread and butter. That sounds scary to a lot of people, especially if your kids are younger, but it's a necessary component of athletics. Practice and games are not enough to become a well-rounded, healthy athlete. Most practices do not incorporate any type of strength training, as she alluded to. Sometimes they're not even doing the warm-ups or the stretches. Many people wonder, including some people here maybe, is lifting weights safe for kids? But really, we need to change that mindset, and we're starting with you guys here today. Really, you should be thinking, what will happen to my kid if they don't get stronger? So strength training is proven to improve coordination and motor control, build stability and protect growing joints, reduce sports injuries. A lot of studies show just strength training alone will reduce injuries up to 50%. It improves confidence in and out of sport, which we know is important for kids, especially nowadays. It enhances their athletic performance, and it'll support a lifelong mindset of bone and metabolic health and just healthy living.
So making strength and conditioning age appropriate. Again, like Corey said earlier, we're not going to put your 8-year-old in a squat rack with the barbell on their back. Strength and conditioning means different things at different ages. So around the age of 7 to 8 is when most kids are ready for some type of like structured conditioning and resistance training. Again, resistance can be body weight. It doesn't have to mean weights. Participation in organized sports alone, again, like Corey mentioned earlier, is not sufficient to support so example, football player. I don't know how many football players I've seen who are 16, 17, 6'2", 250, and I'm like, all right, show me a squat. And it's the most terrible squat I've ever seen. Like, how are you blocking kids however many hours a week? Like, this is why we're getting hurt, right? So it's got to be, again, appropriate for their age. So just, again, to emphasize why not just the sport is important, the actual strength and conditioning is important to support the sport. Like Corey said, you do not want to exceed the number of hours you're training shouldn't exceed your age. And so even though 7 or 8 is around the time when formal strength training can be implemented, you do want to encourage play from birth, really. Think about the playground, swinging on the monkey bars, climbing up the ladder, like all that kind of stuff. And then one specific study showed that before puberty, youth who did resistance training had gains in motor skills that were 50% greater than adolescents, meaning the earlier, the better. It's like learning a language. If you teach a 2-year-old, they're like speaking Spanish and English, like easy. If you try to teach a 15-year-old, they're like, what's going on? Because the brain is at that level that can absorb the information. Same with movement.
Okay, so I love this little girl. I can't stop looking at this picture. Like Brittany said, different ages, strength and conditioning, we use the broad term, it looks very different. They're not lifting those squat rack weights till high school. So in elementary school, strength and conditioning is focused on introductory movement fundamentals, right? We're teaching them coordination, body rhythm, general body control. There's zero weights. An elementary school kid should never be holding a weight unless it's like for fun as part of it, like a 1 pound weight. I don't know, but they should never be lifting weights. Middle school age is where, and if you teach, coach, have middle schoolers, you know, like it's broad for middle schoolers, right? That must be the hardest grade to coach. So that's a more formal strength training approach. We're bringing them through formal strength training. A lot of times, especially the younger ones or the ones that are developing slower, they're just doing body weight stuff. We're teaching them how to do 3 sets of 10 squats just to get their squat technique. We're not focused on intensity, we're focused on technique. I do have a lot of middle schoolers though that I'm giving, 10, 15-pound weights to because they're developed faster. So yeah, between like the 5th and 9th grade age, sometimes they're doing body weight, sometimes they're doing strength, and that doesn't necessarily correlate with their age or what their peers might be doing. But by high school, they should have those movement fundamentals to be able to now lift weights. A lot of high school sports teams do team lifts where they're in the training room lifting weights, whether it's squats, dumbbells, barbells, kettlebells. I just get concerned because a lot of the high schoolers I work with and talk to, there's not like a trainer in there teaching them what to do, but they go to team lifts. And I'm like, hire me for one day, please, to just come in there and show you how to do it, because they can really get hurt. I mean, this guy's picking up, what's that, like 135 or something like that? Like you can be injured if nobody taught you how to deadlift properly before you picked that up, right? But by that age, their bodies should be able to lift weight.
So neuromuscular re-education is basically a fancy way of saying like learning how to move and control your body. It includes things such as agility, balance, coordination, reactivity, speed, power, and core control. So again, when we're saying strength and conditioning, we're in the earlier stage, and in the later stages, referring more to this type of thing. So again, like Corey said, if kids are getting to high school and they're just starting team lifts, okay, I'm going to pick up this weight, but I've never lunged, I've never squatted. You need to teach your body how to do those movements first before we're then adding weight to these activities. And this also goes with kind of like the whole growth spurt thing. If your child goes through a growth spurt and then they're almost like relearning how to like move their body, because again, there's something called proprioception, where your body is in space, and your joints have a lot to do with that. So if you're not then retraining, if last summer you were doing a certain sport or whatever, and then you grew 3 inches, that's going to be a lot different. So that's the time where you need to implement this type of training to avoid injuries.
Yeah. Okay, so fuel. We are not nutritionists, we are not doctors, right? So don't be writing down the things that I say and make it like Bible. If you're concerned with your child's weight, overweight, underweight, or you're concerned with their eating habits, most parents have that intuition. You know when something's wrong. Seek the assistance of a sports or pediatric nutritionist. Talk to your pediatrician about a referral to that. Super important and something to watch out for, especially in girls. But just, the building blocks. Some of these I'm sure you're more familiar with: protein, carbs, everybody hears about that stuff. But there's some little things that you need to just kind of keep in mind and do more research on, or talk to a doctor if you want. Low iron, that's a big thing. It can cause weakness, dizziness, fatigue, which all decrease athletic output. Calcium and vitamin D, essential to bone health. Low calcium and or vitamin D can increase the risk of fracture, including stress fractures, not just like I fell and broke my leg, stress fractures, which you might not even know happened until after they happened. Protein, that's the big one, right? Builds and repairs muscle tissue, more susceptible to tears, strains, and decreasing ability to make appropriate strength gains, even if you're working at it. And then carbs, we know that that's the primary fuel source of high intensity exercise, which is why marathon runners carbo load. Lack of carbs can also contribute to brain fog and loss of concentration, which does affect more than just athletic performance. And then electrolytes, so adequate hydration. A lack of this can lead to cramping, exhaustion, and impair cognitive abilities, which can lead to decreased or increased confusion and decreased reactivity, which can be detrimental if you're playing like a team sport, obviously. Britt was telling me about this podcast that she listened to with a runner.
Is anyone familiar with the Model Health Show? Very good podcast. Highly recommend. Hopefully one day we'll have our own podcast, but for now, you can listen to that. But this is an extreme example, but he was a high school athlete. I think he was like 14 or 15. This is the host of the show. And was a track runner, literally broke his hip just running. That's like unheard of.
Especially for a
and
boy.
It was because he was basically eating like gas station food. Like he was in a low income community, lots of sugar, lots of
Process.
boxed
Yeah.
processed foods. So that like you literally are what you eat, right? And it doesn't have to be extreme. We don't need to give kids eating disorders and things like that, but we do want to be mindful of what we're putting into our bodies, because it really can be detrimental if it's that extreme.
Scary. It's like a scary straight story.
Yeah, yes. So we also mentioned this earlier, but active warm-ups, very, very important. It's going to increase blood flow, body temperature, prepare the muscles for activity. So again, as I mentioned before, you get to soccer practice, boom, you run on the field, you start shooting. Definitely an older age, but as a child too, you're more likely to pull a muscle, because you're, again, asking your body to do something after maybe a 45-minute car ride and not warming up the tissues to prepare for what you're asking your body to do. So it's going to, again, reduce the risk of injury. Specifically, there's one study with soccer athletes who implemented a program called the FIFA 11 that reduced the risk of musculoskeletal injuries by 32% in females and 41% in males. And again, this is like a 10, 15, 20-minute warm-up pre-practice, pre-game. That's it. And you reduce the risk by 32 or 41%. Another study with that same active warm-up focused on focus and attention, and the total score of the attention scale for elementary school children improved by 13 to 18%. So it's not only for sport, it's going to help with school as well. And then one last study on a different warm-up program showed an 83% reduction in knee injuries. So again, very important to implement an active warm-up. Again, I think we mentioned earlier the static stretching before activity that's what I used to do. It wasn't that long ago that I was in middle school and high school, but that's not it anymore. We need an active, dynamic warm-up. If it is appropriate to stretch, save it for the end of practice to improve flexibility and all of that, but you want to do a sport-specific warm-up prior to games, practices, etc.
And a lot of that research that Britt just referenced, research might be like glaze over for you guys. We're like junkies, it's all we read. That is like the basis of the research that we developed our active warm-up strength and conditioning program for the Attleboro Youth Soccer League. So again, we would love to talk to you. We would love to talk to all of you. It's all research-based. We're not just making this stuff up. We read a lot of really boring to you probably research. Then we just give you the good stuff. Okay, so more powerful treatment options. We have some examples if you guys have never heard of this kind of stuff. So these are additional treatment tools that we offer right here at Houghton. It's not, if you're here for PT, it's not like an additional charge. If it's appropriate for you and your kid, it's appropriate for their treatment. You may have heard of kinesio taping. This is a super popular one. So it's literally utilized, you see it on athletes all the time, even if you have never seen it on kids. It's a flexible tape that supports muscles and joints during activity without restricting motion. So this is something that we can apply here. We try it a lot of times, so I'll give it to a kid if I think it's appropriate. I'll put it on them. We'll use it in the session. A lot of times they're going to practice or something later after or the next day and it stays on. So we can trial it out. We can trial it in PT. We can trial it in their sport. I can do it a few times, and if it really works, you can buy this on Amazon, at CVS, at Walmart, whatever. You can come in, I can show you how to put it on them the same way that I did, or some body parts, if it's like their knee or something. A lot of like older kids can figure out how to put it on themselves, but it doesn't restrict motion at all. I could throw, catch. This isn't my throwing arm, so I couldn't throw anything, but you can throw, catch, do anything. It can go on basically any part of your body. They sell them that are like really high intense waterproof. So if they're in a sport that's super sweaty or they're in a water sport, I've had the high performance one when I had an Achilles tear, and I literally wore it and it didn't come off for like 7 days, even in the shower. Kind of hard to get off at that point, but that's something that we can cross when that bridge comes. But it doesn't restrict you at all. It's super affordable. It's super easy to apply if you're taught. And that's something that we use here. blood flow restriction training. That's kind of a newer thing. I don't know if you guys have heard about it, BFR. It's a way to make muscles work harder without increasing the load. So a lot of times if somebody's new to working out, if they had a surgery or like an injury that requires like doctor intervention and they don't want them using any weights for a while, this is a way that we can make the muscles work really, really hard without giving them additional weight. So it's basically a blood pressure cuff. You can put it on your arm for an arm thing or your leg. She's putting it on her leg right now. So she'd probably be working like her quads or her ankle or something like that. You pump it up. She doesn't need to do it now. Totally safe. I've used it on middle schoolers, elementary. I've used it on middle schoolers up. It's basically a blood pressure cuff. So it's gonna read, the machine reads your occlusion. It's not gonna occlude you completely or your leg would die, right? So it goes to like 50, 60, 70% depending on what we set it to. And then it essentially puts your muscles in fight or flight. So your quads, your glutes, your calf, whatever, are gonna work super duper hard, thinking like if I don't work really hard right now, I'm gonna lose my blood. That doesn't happen unless they have like a cardiac problem. It's totally safe for them. And basically they can do 30 squats with that on and it's gonna feel like they did 10 squats with 100 pounds on their back. So it just really helps football players, especially those older, getting bulkier kids to really like work it hard and they'll be walking out of here with jelly legs without even lifting a weight. And then we have instrument-assisted soft tissue mobilization. So this is a hands-on technique. It's like a more in-tune way to do massage. So we have Graston tools and we also have cups. A lot of you have probably heard of cupping or at least seen like the big circles on Olympic athletes' backs or whatever. Both ways to break up just like tight muscle, tight fascia, scar tissue without me massaging you for 20 minutes because let's be honest, we don't have that time. We have that time to spend on other stuff. So yeah, doesn't hurt. That's not a knife in her hand, I promise.
It looks like a butter knife.
Sometimes it's a little uncomfortable, but it's like short-term discomfort, not even pain. Sometimes you feel nothing at all for like long-term gain. So again, tools that we use here, it's not an additional charge for us to use these tools. If we see you and it's something that you benefit from, we have the tools here to use. Now my arm feels good.
Okay, so mental health, again, we are not psychiatrists, psychologists, mental health experts, but sport or no physical activity can obviously both have an effect on mental health. Here we're talking more about sport in particular, but again, I wish when I was younger, along with the nutrition too, because my brother struggles with mental health and he was not an athlete. He was an athlete till like the age of 10 and then kind of fell off. And I'm not saying that's why he has mental health issues, but just like the awareness of how beneficial it could have been. He also has chronic pain. So again, it's huge. A huge reason to stay active and a huge reason not to be overly active because then that could also lead to mental health issues or not wanting to participate in sports anymore. So some things to watch for: withdrawal from teammates or believing that they don't fit in. Again, going along with maybe they're a little bit behind their peers because they might have had a growth spurt and they don't have good control over their body, etc. Complaints of frequent aches and pains without an injury. Expresses, again, feeling burnt out, saying they're not having fun in their sport. Anxious, irritable, frustrated, especially before practices or games. They stop looking forward to practice or games. They show less effort or enthusiasm during training, or they prefer to do other activities that they may not have previously been interested in. Which again, if I actually have multiple friends who are therapists too, so I can give referrals as well. Different type of therapist.
Okay, so daily habits to protect these guys. So building just a few small, consistent habits can lead to huge gains for your child. Take what you learned today, think about something you can try to implement pretty quickly or easily in the next week or so. Some of these things obviously take longer time to educate yourselves on or to build the rapport. Try to make, figure what works with you, your family, your schedule, your kid. So some ideas are building those real warm-up habits. So a proper dynamic warm-up that includes movement prep, not just static stretching like we did. This should be part of their team's warm-up. A lot of times it's not, and if we could meet every single coach in the whole entire world, it would be, right? But We got to start somewhere. So if it's not, maybe the coach just isn't informed, right? Don't be afraid to speak up, right? Don't feel like you're being that parent, because your child's health and safety is your responsibility, right? So just politely inform the coach, ask about their dynamic warm-ups. They just might say, what are you talking about? We don't know what that is, right? So, that's on you to kind of speak up. And like you said, maybe that's something, if the coach isn't willing to do it, I do it with my child for 10 minutes. We get to practice 10 minutes early. We do it on the field ourselves. But for the coaches in the room, something for sure to think about. Age-appropriate strength training. Oh, down here, sorry. Including strength training. That is one of the most powerful injury prevention tools available, and it doesn't really take anything besides your education. Just 2 focused strength training sessions a week at the elementary, middle school age can make or break a child's performance for the rest of their athletic career, whether that's through high school, college. Some of them will go to the pros, right? Or they'll just play recreationally through adulthood, like Brittany. So starting that off early is huge, and that's something you can start to implement tomorrow, right? Sleep and recovery, like we said, finding time for this and quality time for this is huge. This time is crucial for development on and off the field, not just about sports. Starting it now carries over into adulthood. I stopped growing a long time ago, and I need 9 hours of sleep a night, or it's not going to be good for my morning patient. So, that's important, and building that habit early, especially when they're teenagers and it's impossible to get them off their phone, trying to set that habit early. Building in the rest days and the off-season times, huge. Doesn't mean your kid's being lazy. They need it. They need it to develop. They need it to recover. Year-round specialization is causing injuries. Most of the youth athletes we're treating right now, they're year-round athletes, whether it's in one sport or they go from sport to sport, 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 sport. I have a couple kids who, after I see them in PT, they play 2 sports later that evening. I'm like, oh my goodness. It's rampant right now. It's just like the new thing, right? Like we said. So let us help you, help them, educate the coach, educate the other parent. They got to take breaks.
Okay, so what basically the treatment would look like here, hopefully elsewhere too, but we can guarantee that it will be like this. It's going to start with a comprehensive assessment. We're going to get to know your child. What are their sports? How long have they been playing them? How many hours a week are they playing? Those are things that sometimes aren't even asked, right? Like, if all we need to do is take a rest day, and that's all we needed to hear, I'd rather have that than, oh, you need to be in PT for 6 months because you hurt yourself because you didn't take 1 day off, right? So getting the full picture, how do they move? Where are the gaps? Is one side stronger than the other? Is one side tighter than the other? And could that be the reason for the injuries? So again, a personalized plan. There is not, okay, you're a 12-year-old football player. This is your plan. You're a 6-year-old soccer player. It's different for every kid. And again, what stage are they in? Did they just have a growth spurt, etc. And then again, we would move into exercise training. So again, what does your child need depending on their age, depending on if they are injured or if we're just trying to prevent an injury. And that's when we would again potentially use weights, or resistance training, balance. All of those things are implemented during the exercise training, and then return back to sport, ideally stronger than ever. Again, maybe they didn't even have an injury or not a current injury, but we're trying to prevent a reoccurring injury. So we, again, want them to thrive and not just play the sport. We want them to know how to use their body and maintain good habits, so that, again, we can avoid risk of injury down the road.
Okay, so small little sidebar, but it seems like somebody in the room specifically is interested in this. And you might be thinking of, your niece, your nephew, or a family friend who has a kid who they're not interested in sports. They're underweight, they're overweight. You've heard their parent be concerned about it. So just because the child isn't interested in sports and they're not very active doesn't mean it's not important, right? They don't have to go and play a team sport to be active. There's plenty of kids who are active that don't play a team sport. Physical activity is not just about sports, right? It's essential for a child's overall health and well-being, like Brittany talked to, mental health, especially physical health, development, happiness. All children should be getting 60 minutes of physical activity a day. That can be recess, that can be gym class, that can be playing at the park with their friends. Doesn't have to be sport, practice, training, just some kind of physical activity to improve oxygenation of their tissues, circulation of their body, right? We don't have to get super sciencey. It's going to improve their development. It's going to decrease the risk of them being unhealthy as an adult. Diabetes, obesity, heart disease, cardiovascular disease, all that kind of stuff. And again, we've talked about the habits, right? It just builds those habits. So trying to keep them active even if they're not interested in sport, right?
There's a quote that I like that I think I got from the podcast I was referring to earlier, but it's we don't stop playing because we get older. We get older because we stop playing, right? When you're a little kid, you're jumping across. My nephew's 4. He's jumping across. He doesn't walk anywhere. He's jumping on everything, rolling around. Like, we don't want to stop doing those things. So simple ways to keep kids moving who maybe aren't interested in sports. Limiting screen time. Obviously, that's huge right now. I'm a TikTok fan myself, but shouldn't be on it all day, every day. Encourage outdoor play, even if it's just in the backyard. Walk or bike as a family. Make it fun. You can have dance parties, obstacle courses. I personally, when I work with kids, love setting up or actually all people love setting up an obstacle course. Trick them into working out. They don't even realize they're exercising, right? And then just one other factor with the video games / screen time. One study showed that more than 3 hours of video games a day led to increased elbow and shoulder injuries in overhead athletes. So it's recommended that it's less than 1 hour a day.
Yeah, and that's for athletic kids. I got that.
Yes.
I recently actually took another course about like specifically baseball players. And this study was from 2018, which was before COVID, so we know kids weren't even playing video games as much back then. But yeah, kids that were active, this was baseball pitchers, I believe, were more at risk of elbow and shoulder injuries when they played more video games despite being strong and athletic. Oh, somebody who plays a sport like overhead. So like a pitcher, a tennis player, anybody who throws really. Basketball technically, yep. Volleyball is always that, swimmer, baseball, softball. But yeah, basketball, I mean, they're going overhead for sure, yeah. Is this me? Oh yeah, sorry. Okay, I was just talking. Okay, how to stay informed as a parent. So as I mentioned before, you're their biggest cheerleader, but you're also their biggest advocate, right? Don't be afraid to speak up if you think something isn't going right with a coach, another kid, another parent, something like that, right? It's your job to protect them. A lot of youth coaches, who I love that there's a bunch here, it's not just parents, but a lot of youth coaches volunteer and they don't really know much, or they're voluntold to do it. They're like, well, the kid's not gonna have a team this year if nobody does it. And you're like, I guess I gotta do it, right? Which I totally respect. But don't assume that your child's coach has done all the research to make the best decisions. Don't assume that they showed up here to listen to us speak, although thank you so much for coming. So choose the right coach, team, program for your kid. It doesn't mean they're the bad coach. They might not be the right fit for you and your kid right now if they're not understanding your needs. Understand the league's safety policies, especially with concussions, stuff like that, pitch counts, a lot of that stuff is big now. Make sure that it's a league policy and make sure that it's actually being enforced. Encourage open communication between you and your child all the time. I always relate this to like when you send your kid to daycare first and you're like, I want to make sure that my kid is like being taken care of at daycare. I want you teach them to like tell me if somebody does something to you, right? Same thing, make sure that they're openly communicating with you about what's happening in their sport. Are they being bullied by other kids? Are they being bullied by their coach? Is the right thing happening? And then again, having that open communication between you and your child and the coach. That stuff's all really important. As hard as it is, especially in those in-between phases, don't compare your kid to other kids. I say especially in middle school, that's such a hard age in general, right? If your kid is noticeably lacking in their development, their skills, their speed, the way that they move compared to their peers, feel free to discuss this with somebody, your pediatrician, the coach. Come to us if you're like, I don't know if this is worth seeing the pediatrician. I always say we're happy to be the first resource. If you're like, oh, he's just a noodly middle schooler, like we can tell you if that's an average amount of noodly. We might just say, yeah, he's a noodly middle schooler. Let's work on some stuff. But we might say, ooh, he's like unnaturally noodly. Something might be going on here. So always speak up. No question's a stupid question, especially when it comes to your kids. Girl parents, big thing, girl parents, especially in field sports, soccer, field hockey, other field sports. They are super at risk for ACL injuries or tears, especially like during and right after puberty, just the way the body changes. Their bodies start to develop differently. This is huge. So strength training, active warm-ups, all that stuff. An ACL tear that leads to surgery is going to put them out of sport for at least a year. And then burnout, like we talked about multiple times, injury and or exhaustion, AKA burnout, is the leading reason that adolescents drop out of sports that they once loved. So yeah, you're the parent, help them out. Don't be the pressure cooker that stops them from loving the game. I see that far too often.
Okay, so healthy habits do start with the parent and the coach. So basically your kid is gonna mimic what they see, right? So again, I was kind of talking about my childhood growing up. I played sports. I went to my sports. That was it. That was sometimes I played outside. Like I played, manhunt with the neighborhood kids, but like my parents did not exercise. I did not see them exercise. They still do not exercise despite how much I tell them to. So if you act the way you want your child to act, obviously that's going to be beneficial to them. So some other things, positive sideline behavior. If you're overly screaming at your kid, they might feel too much pressure, maybe even like pushing themselves too far if something does hurt. Like, I'm not gonna tell my mom, she's gonna freak out, So obviously positive behavior is helpful. Again, supporting without pressuring, not like, I play baseball, you're gonna play baseball. If baseball's not their thing, they can find another, even if it's not a sport, again, I just wanna go to the playground. Okay, cool. As long as you're moving your body, we're good. Giving them permission to be honest, like kind of Corey was saying, without fear of disappointing, whether this is hurting more than I was leading on, I really don't like this sport anymore, etc. Consider breaks if they do seem burnt out. Maybe we're not going to quit, right? But maybe we'll take 2 weeks off and see if we feel better and if we do still want to do this sport. Again, they don't just listen, they watch. They're going to mimic what you're doing. So the more active you are, the more active likely they will be. And then another really interesting thing that kind of goes along with nutrition, but a study showed that children who ate at least 3 meals a week with their family were 24% more likely to eat healthy foods, 20% less likely to eat unhealthy foods, 12% less likely to be overweight, and 35% less likely to have disordered eating behaviors. So again, all you have to do is eat as a family 3 days a week and your kid's getting major benefits. So I just thought that was a cool,
Yeah,
again,
it's an
from that
interesting one.
same podcast.
It's a good podcast.
It is.
You guys got to all listen to this. Okay, so big mistakes that can make injuries worse, right? We already alluded to some of these, but these are the big ones. Returning too soon. Feeling better does not mean healed. Feeling better does not mean healed. Are they listening? Do you want me to say it a third time? This is true. If I stopped treating every patient that I treat just when they came in and said, yeah, I'm starting to feel better, they would all be coming back, right? That would be a disservice. I would discharge them and then they would come back a month later. I mean, the same people and over, that'd get boring. That's not just kids, right? We treat people ages 9 to 99, yeah? We don't discharge them when they get better. That doesn't mean they're ready to get back out on the field full-fledged. Especially after a major injury or a surgery, there's research-based return to sport or return to activity protocols that people have spent years researching, and people like us have spent years learning and stuff like that, right? So don't make our education go to waste. When they have a major injury, there is a protocol that we follow, that we check this box, then we can move on to this. We check this box, then we can move on to this. There's a way to do it, right? And come to us. It might be something minor where we say, do it based on how you feel, but it might not be, right? So you don't want to do the wrong thing and then end up starting all over. Ignoring the early warning signs is a big one. Reoccurring soreness, reduced performance, that stuff's all early signs. It may seem like a little bit of discomfort or they're just slowing down, but that could be a sign of something big to come. And we would love to just, meet you quick, take a look before something minor becomes major. Might be minor, but it might be, oh yeah, I see this all the time. This is about to be something major. On the same route, I went out of order, sorry. Rest alone is not rehab. Too many kids sprain the ankle, sit out a week, throw a brace on it for a couple weeks, and then they're back. They're gonna sprain their ankle again, I can promise you that. Anytime there's an injury, there's an underlying issue that caused it, right? That's the first thing. And then also anytime there's an injury, the body reacts to that injury. So we often have to retrain strength, retrain coordination, retrain their proprioception and motor control, and potentially fix what caused it in the first place. And then early specialization, I'm sorry, we're gonna say it again. If your kid is 14 years old and all they do is play football, that doesn't mean they're gonna be Tom Brady, whatever sport it is, Lionel Messi, Caitlin Clark, they're at a huge risk for overuse injury or worse. Specialization in a single sport year-round is highly frowned upon by all pediatric sports medicine doctors and specialists. They say age 14, it's usually around high school. Once they get to high school, if there's something that they're really serious about, that colleges are scouting them, yeah, sure, they can definitely start to specialize then, but middle school should never be specializing, and it's happening a lot nowadays. Yeah.
So some frequently asked questions, some of which we've addressed, but would need to reiterate. Is my child too young for strength training? So like we said earlier, if they're old enough to go to school, follow directions, play organized sports, then no, it's not too early. It's appropriate to begin low-level formal strength and conditioning between ages 6 and 8. Will strengthening exercises stunt my child's growth? This is a really common misconception, which again, is it ideal to put a 100-pound barbell on a 6-year-old? No, not ideal at all. But strength training
Not
is
gonna happen here.
going to stunt your child's growth. If anything, it will actually help them develop better. And again, that's with a licensed professional of some kind and guidance. How do I know if an injury needs physical therapy or just rest? We're going to get to this again in some upcoming slides, but that's kind of where we come in, where we want to be a resource that, do I need to call the doctor? I'm not sure. Let me call Houghton and see if I should see a doctor or just let them rest, or maybe we need to throw a brace on it, etc. And then again, we're going to get into this in future slides, but a movement screen is something that we offer that basically is just going to assess their movement patterns with some basic things, squat, lunge, single leg balance, and assess if that could be an injury risk factor, basically.
So how our approach here at Houghton is different. We don't only want to see your child after they're injured or after they already had the surgery or after they already had the doctor's appointment. We're providing you this free education. We hope to talk to you guys again after tonight. We hope to see you again. If we don't, you got this free education. No harm, no foul. If I see you at Stop and Shop, I'll say hi. So I'd love for every single one of you, all of the children that you coach or have that you're parents of, we want them to live injury-free. I don't ever want them to get injured, right? I'd still like to have a relationship with you guys and with them without injury. So we can help them get stronger. We can help them know more. We can help them know better to maintain that lifelong health that we keep preaching. So we can tailor a program to your child, to your needs. Like she said, and I think I might have said too, we don't have one template. Okay, it's a 12-year-old baseball player, that's a boy, we're gonna do this program. Okay, it's a 6-year-old, we're gonna do this program. Like, we look at your child, we assess their movement, we assess where they've been, we assess where they're trying to go, and we develop every program towards them. And then the parents are always part of it as well. So we would love to have you come to the sessions if you can't, and after we get to know you, drop them off, that's fine. But when we're doing the treatment plan, we want you there. We want it to be, like we said, one-on-one communication with us and the kid, with you and the coach, with us and the coach, like whatever we have to do to make it a team, we're happy to do that. So we want it to kind of be, you know, everyone's part of the process. It's not me and your kid are working on PT. It's not me and you are talking about your kid. We want it to kind of be all in one. And again, pre-injury.
Okay, so some consequences of inaction, not to scare anybody, but again, we want to attempt to prevent injuries as best we can, right? We don't want, oh, I tore my ACL, whoops, I didn't do anything to try to prevent it, right? So some consequences can be progressive or worsening or permanent damage, increased risk for future surgery, not playing for a season, or again, losing a scholarship because of an injury, and then state of mind and joy for sport is declining. They don't want to be physically active anymore because we didn't take action earlier than we maybe should have.
Okay, so on top of this, we have two, I mean, you have a lot of options, but we have two like options that we want to present to you today. And there is I think you all have one of these on your table. So as we explain these to you, feel free to fill them out. Britt?
So a discovery visit is basically a free 30-minute one-on-one session with the therapist. They're, again, not going to get every detail right, but like, what's bringing you in? Do you have an injury? are you currently uninjured, but you have a reoccurring injury that you want to prevent? Is there something that's just nagging, et cetera? And again, they'll ask, what is the sport? How often are they playing? And then decide, okay, we think you should do physical therapy. We think you should just put a brace on for the next few games. We think you should go to a strength and conditioning coach, et cetera. Or go to the ER, see your primary care, et cetera. So we kind of want to be that bridge that's like, okay, my kid got hurt 3 days ago. Should I take him to the doctor, or like, can we hold off? And we actually have personal extensions. We'll answer on the weekend to like set
Within
those
reason.
up. Yes. Not like a minute on the day.
They're in the back, I think they're in the back of that folder.
Yeah, they're somewhere in your paperwork.
There's a booklet in the.
Oh, in the education packet, the colored one with the kids on it, yeah.
Yeah, I think our extensions are, if not. we
So
can
you could always shoot us
write
an
them
email,
down,
you
too.
could always call, and if we don't answer, leave a message, and we could call or text you back. Yeah, if it's kind of like a hotline, don't, my kid just broke their ankle, what do I do? You need to go to an urgent care, but yeah, we're happy to be that kind of one-stop shop research. This is our passion. The other option is a movement screen, which is specific to this. Can you hear me over the rain? Sorry, this building is really loud. The 20-minute movement screen is something that we developed for something previously, but is not offered to just like any patient. That's really for you guys here and you guys there. So Britt and I developed this youth athlete functional movement screening form. So it brings them through kind of like full body. I think there's 15 to 20 tests on here. I don't remember, we made it a while ago. And it scores them on, did you do a single leg bridge optimally? Is it poor? Is it somewhere in the middle? We assess if, there's one notable thing like, oh, your movements looked pretty good, but your ankles looked terrible on all of it. Was there pain with certain movements? And we kind of score them based on that. Were there any major red flags? And based on that information, you, parents together, coach, kids can kind of make a decision and say, we should probably get some strength training, or we should probably get some physical therapy. So rather than just sitting in the discovery visit, not that that's wrong, and just having a conversation, this is a better option for the child who does not have an injury or does not have like a recent series of injuries, and you're just like, I'm worried something could happen because nothing has happened yet. Let's get a movement screen. And either Britt or I run them through the full body gamut, check everything, and say, you look great, or you got these couple things that really need to be worked on, whether you do it with us or not. You take this home and you know what their deficits are.
So sorry to interrupt.
No.
Like those kids that maybe aren't keeping up with their teammates, right? Like they're in U12 soccer, and you're like, I don't think it's like a talent issue, right? Like it typically isn't. It's, are they able to keep up with their peers, and why not, right? And that's kind of where that
Can
comes in.
usually show those asymmetries or those deficits that we
Yeah.
alluded to a couple times. So like I said, you have these on your paper, or talk to us after, or give us a call or whatever. If you're interested in this, circle what you are interested in, or you can just write on here, I don't know what I'm interested in, I'm really confused, I'm overwhelmed, please have Corey or Brittany call me, and give that to us, and we can absolutely reach out. Yeah, perfect. That's our team. You didn't meet all those people, but so thank you guys so much for coming. If you have any like broad questions, we would love to answer them, because other people might be having them too. If you have anything personal, we would obviously love to set up a time to spend with you more. Yeah.
Insurance cover physical therapy before an injury?
Typically, no. Typically not, because most insurances, you do require a referral from your doctor.
So I got my pediatrician to give us a referral.
Oh, yeah.
Without an injury, but he's like, I'll do the referral, but I don't know if the insurance is gonna do it.
Yeah, and it really depends, right? So like insurance is not my forte. Thank God there are people who that's all they do.
But it's gonna cost the insurance a lot more money if they have to pay.
Oh yeah, that's a whole nother workshop that we don't have time for today. That's called the American Healthcare Workshop, and you don't want me to get into that. Yeah, so honestly, if your doctor wrote a prescription, they have an evaluation, it's typically at least covered with the prescription. If we find deficits that deems them medically necessary to do physical therapy, it's usually not a problem. Usually getting the prescription is the problem. You can always do physical therapy. Massachusetts is a direct access state, so you're welcome to come to physical therapy without a doctor ever touching you. It's just a matter of if insurance pays for it. That's where the script comes in.
And then you guys like
Yeah. Yeah, we don't offer them here, like we don't sell braces. Most of us, especially the two of us I know for sure, are very well versed in what type of bracing or taping or anything they would need. It might be you getting a custom thing. It's usually not for me unless it's a major injury. I very, 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 very rarely. Oh, absolutely. Absolutely. We don't sell them here. The two of us for sure, can absolutely tell you which ones you need and where you can get them, whether it's Amazon, CVS, whatever.
Would you like instruct, like, right now in North Attleboro, they don't have an athletic trainer. So they would be the ones taping like my son's ankle or my son's knee or, whatever it was before the game. So now he's like, I just gotta tape my ankle. What do you know?
Yeah. Yeah. Yeah, if it's something that they're indicated for, like I said with this, we absolutely can show them how to do it. A lot of times he says, I just need to tape my ankle, and I bet you I'm gonna meet him and say, you don't need to tape your ankle. So there's that caveat too, but if it's something like athletic taping for stability, this kinesio taping, any of that stuff, if we do it and it helps them, I know you can, and other
Some of you guys
therapists.
have to be a patient here to like to learn how to do it.
Yeah, yep.
And again, with the bracing too, ideally, 'cause I chronically sprained my ankles, still do it sometimes, but I'm better now. But you don't want to have to rely on braces,
Yeah.
right? Like, let's figure out what the underlying issue is. And again, when we were to do a discovery visit or something, maybe it's let's throw a brace on for a couple of weeks, but we don't want to rely on it like long term. Like
Yeah.
I see football players a lot with 2 braces on, and they've played with them all 4 years of high school, and I'm like, what's going on here? Like, there's a reason why you need those. We should figure that out.
Yeah, the pro athletes that like in the middle of the game, their ankle gets taped to crap so it doesn't go anywhere. That's a Band-Aid so that they can keep playing for millions of dollars.
Yeah.
They're doing a lot of rehab. They're doing a lot of rehab for the rest of the week on that ankle. Yeah. Any other questions? Fabulous. Yeah. Yeah.
Sure.
Thank you guys so much for coming. Again, reach out to us. You definitely have our emails and our phone extensions. If you call me at 10 o'clock tonight, I will be sleeping, but if you leave a message, I can call or text you back. We'd love to chat more with any of you about anything specific you need to know. It's our passion.
How long does it take to get in here? Like, do you have like, you're booking like 2 months out or you get a same day appointment? Like, are you guys?
Are we doing like the workshop special access thing? We do that usually, right? If you came to the workshop and you call and you say, I came to the workshop, it's pretty quick. You might just have to be flexible with your times, which is definitely more helpful now in the summer.
Summer's a lot better, but depending on, the time of day.
Yeah.
If it needs to be a certain time, sometimes 5 p.m. is hard.
Right, yeah.
If you're more flexible, then we can get you in pretty.
Yeah, and if you call and you say you're at the workshop, they usually prioritize you for sure. If you reach out to one of us, we can put you on our schedule whenever we can fit it. So yeah, that's another way to kind of back end do it because we know our schedules better than the front desk does. So if anyone wants to be in the picture, come on up. If you don't, I will take a picture alone. Don't feel like you need to. Come on, girls, you learned so much.
And you guys can follow us on TikTok. They're not.
We do funny TikToks.
They're pretty funny.
Well,
yeah.
we think they're funny, but we're in our 30s,
Yeah.
so.
Well, I'm almost 50, so nothing's funny.
Yeah. Yeah, we're cooler than your mom.
Thank you, guys. I'm gonna take 2. I'm gonna take one portrait and one landscape. Right? 1, 2, 3. And then another one this way. 1, 2, 3. Perfect. Thanks, guys.
Awesome. Thank you guys so much. Watch out for those things.
We forgot to use them.
Thank you guys for coming. Love the coaches.
Can I look at your movement screen?
Yeah, absolutely.
I once was reading, or seeing videos by somebody, his name was Gray or something. You ever hear?
Oh, Gary Gray.
Yeah.
Yeah. Yep.
So.
Yeah, so that's the functional movement screen. I actually have that certification. That's just a generic, like, functional movement screen for everything. This, I mean, I guess this is loosely based on that. It's similar, like, step over parkour is on there, squat is on there, lunge is on there. This is more geared towards youth.
Guys, putting this all together.
Yeah,
I don't know
Thanks. Yeah.
what options there are for, you know, like I said, I coach for the volleyball right at the school over here, and I know that the principal has, is, you know, they have soccer